Top story tonight, air quality slightly better than the past few days, but taking a live look at San Jose right now, definitely you can see the haze there that's over the downtown, and that looks and is unhealthy. And here's a map of the air quality index in the Bay Area. On Friday, we had a sea of purple. Now it's mostly red, a small incremental improvement. The air alert has been extended 2 more days, now ending on Wednesday instead of today, and that makes for a record-breaking 30 days in a row. So, what does that mean for our long-term health? KPIX 5's Juliette Goodrich joins us now from San Ramon. Juliette?
Yes, Ken, what does that mean? Doctors are saying we are in unchartered territory, so down the road we don't have the science to back it up in terms of 30 days of bad air. Take a look at this. We have another couple of days of this bad air quality, but I can tell you that these doors right here, instant urgent care, have been opening and shutting all day long. People going in with ailments of hard to breathe times, runny eyes, headache, you name it. Some people thinking, do I have COVID or is it related to bad air? Despite cabin fever, doctors say hunker down, Bay Area. That means stay inside with windows and doors shut. And yes, that means no outdoor exercising.
I figured I'd go ahead and take the chance in going outside, but it definitely is a bit of a concern.
I stepped outside momentarily to do my interview with Aaron Richardson. He's with the Bay Area Air Quality Management District.
Just standing here, I see some ash coming onto my computer screen, but I don't feel like I'm breathing in that particulate matter. But that's deceiving, correct?
It is deceiving, and it's, the ash is large and it's heavy and it's falling out of the air and it's disturbing, and bothersome. But the truth is it's those fine particulates that are really pretty much invisible to the naked eye.
And doctors say that is what we are breathing deep into our respiratory system, causing lung inflammation. Not good.
Are you going to drop dead of a heart attack? Are you going to have an asthma attack if you've never had asthma? Probably not. But we don't know about the long-term effects.
Dr. Dave Pepper is known as the air doctor. He says the particles burning our houses, forests, grasslands, propane tanks. It's a complex soup, and we're in it.
Some of the long-term heart and lung, and particularly diseases, are going to be things that we will see.
Instant urgent care clinics like this one in San Ramon keeping busy with patients thinking they might have COVID due to the poor air quality.
There are a lot of people that are coming with new onset headaches, new onset cough, new onset shortness of breath, people who have no previous respiratory conditions.
Yeah, Juliette, I'm wondering, we're all wearing masks now when we're outside. You've got one on today. Do they offer any sort of protection from this kind of smoky air?
So the regular masks offer protection from COVID. You need specifically the N95 mask that I'm wearing today. Urgent care gave me this mask for the story and to show you, but otherwise it doesn't protect you if you have the regular masks from those particulates in the air. You must have the N95. It has to fit snug. Best advice, stay indoors.
Yeah, well. All right, Juliette Goodrich reporting live from San Ramon. Thanks, Juliette.